Hello and good evening. We are live here on ATG. My name is Dr. Alalade Babajide, one of your admins on AsktheGynaecologist. And tonight, I'll be talking about a weak erection in men and how to deal with it. If you're watching me now on Facebook, I'm your host once again. Dr. Babajide is my name. I'm hoping that this transmission is going to go well and go perfectly okay. Today, for the first time in a long time, I'm presenting while standing up, and we are simultaneously broadcasting on Instagram. So watching me here, and we're also live here on Facebook as well, and we are recording on YouTube for future publication as well. So if you're free, if you are available, join me now and let's talk about this topic. Okay, and I'll tell you the reasons why I've chosen this topic and why this topic is very, very hot and how we can deal with it together. Weak erection is a big problem. It's a huge problem. I used to think I had that problem before until in my previous life, I would say, and until I found a way to deal with it. So today I'll be talking about this topic, and I hope that if you're a guy, you're available, join. If you're a lady, please record this video or tag your husband or your fiancé and let them watch at some point whenever they are free. Once again, my name is Dr. Alalade. I'm one of your admins here and your host at AsktheGynaecologist. And with all due pleasure, I'm happy tonight to be taking you through this topic. So if you're free, join me as always. And if you go to churches, they always do prayer and fasting, and they will talk about women going through infertility. They'll say, if you're a woman, you're going through infertility, get up. But nobody always says, if you're a man, you're going through infertility, come out, let us pray for you. It's always the women people are targeting. And that thing always gives me a stir in my mind, and I wonder that we as doctors, Gynae, we know that infertility is 40% male problem, about 50% woman problem, then the remaining 10% is probably both. So I always wonder why people always assume that the woman must be the person with the problem whenever infertility is the issue. Do you know men to go through infertility? Do you know men suffer from weak erection? And whenever men go through stuff, they don't talk about it, because we as men, we just design like that. For example, now, if you're driving with your wife and two of you, you probably lost on the way, the guy will hesitate to ask for directions, but the woman will always stop a passerby and ask for directions. Women love to ask for direction. They love to get help, but men are designed sometimes for their own purpose, for purposeful ego. They don't want to ask for directions. They don't want to get help, and men go through problems and denying themselves opportunity to change their lives. So once again, I want to say good evening to you all. If you're watching me, it's a pleasure to be your host today. My name is Dr. Alalade, and I want to give you thumbs up so that you be the first people or first one to hear this information. ATG is working on a new laboratory to open in Surulere so that we can capture people. We've realized that Surulere is more central to people in Nigeria, in Lagos especially, and we want to move to the heart of Lagos so that we can encourage people and we can capture people, and people can get their tests done if they have to. Surulere is very close to the airport as well, and Surulere is very central in Lagos, on Lagos mainland, and definitely people will benefit most especially from that laboratory that will be situated in Surulere. We are working on it. It will happen soon by the grace of God. So I want to say good evening to you. I want to get you aware that ATG now does hysteroscopy at the ATG IVF Center. We've worked on so many things. Now we are able to do our own hysteroscopy. And if you're going through recurrent miscarriages, heavy bleeding, you're not able to solve it, uterine abnormalities, scar tissue in your womb, and so on and so forth, ATG Laboratory IVF Center now has facility to do hysteroscopy. So now let us start. We have people watching already on Instagram, and people are already watching on Facebook as well. So this topic is ready to. Now, the number one cause of weak erection in men that I've come to realize from personal experience is stress. When the man is stressed, business is not going fine, there's trouble at home, contract issues, bills and all that, and family pressure, a man does not have that strong erection. That is the honest truth. But I know some men, they'll be going through things, they'll be going through challenges, still yet they will have erection. In fact, that's when they will start chasing girlfriend around. But most men, 80%, whenever they're going through stressful situation, they don't have good erection. If your wife is sick, your child is sick, blah, 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 erection is going to be the last thing on your mind. Okay? Yes, that is truth. But a typical man will have erection close to 50 times a day. Men, they are usually driven by visual stimuli. What they see those two pure water dangling and shaking in their front. They get erection. It's common with men, definitely. There's nothing wrong with you having an erection if you see a woman pass. Just understand, you are designed that way as a guy. It's not a sin. Don't start casting out any demon. There's no demon working in you. It is you. It is God in you. Okay? But now you need to learn to discipline yourself so that you don't carry out things that are not civilized. So you do things in a civilized way. Okay? That's why we are humans. We are civilized people. But there's nothing wrong in you as a man seeing a beautiful woman and having an erection. There's nothing wrong, okay? It's not, if you now misbehave, you go and do what is uncivil, then you now become a social demeanor. But there's nothing wrong in you seeing a beautiful lady and acknowledging. There's nothing wrong. It is God-given. Even people will see a beautiful guy, a girl will see a beautiful guy, they will acknowledge. It's natural. It's not a sin. So don't start casting out demons that are not even there. It is you. But even if it's a demon, then it's a demon in you. But medically speaking, stress is a big factor. Stress is a big problem that can affect erection. If you're going through situations that are battling you, it's happened to me before too. And it can be. Sometimes too, if you have stress at home, sometimes it can be the fault of the woman. Some women are just difficult, okay? They're not turned on for some reason. And there's no way the guy will do a maneuver. It's not going to happen. It's very common after delivery. It's very common if a woman is going through life challenges. If someone died at home, so on and so forth, women go to that stressful situation and women don't get erection in their clitoris, they don't get stimulated. And sometimes as well, what stimulates you as a guy might not be what stimulates your wife. And definitely two of you cannot find that common ground. It happens. But you need to grow together. You should not grow apart. Medical things can also, number two, medical issues can affect. Everybody, good evening. I can see everybody joining on. I can see Ayotomi Wadebayo, Becky Lars Ebute. I can see Blessing Ezekiah. I can see Amalara Okay, God's Love Mode, Julia Donatus Onibo, Gloria Nwako, Konji, one of our moderators, wonderful lady, Miss Unzubechuku. Thank you so much. And Eniola Ajibi, Nwahiri, Chika Emele. And also on Instagram, we have 5 people viewing. Momo Fati, Bims Couture, Sweet Something, wonderful lady. We have Christiana Olademoye. Thank you so much, Christina, for being here. And we have most of our viewers watching on Facebook. Thank you, guys. And we're also recording on YouTube for publication at some point soon. Okay, anyhow, let's continue. So, Doris Julius Okomaye, Juliet Nwa Buneze Ebo, Oluebobe Favor, and people are joining in. So if you're just coming in, settle in, and let us continue our discussion. You can watch the video at your own free time, catch up at your own free time, and we can keep talking. Okay, Becky Lars Ebute, Ayotomi Adebayo, thank you, ladies. God bless you all. I know people are still coming back from home. If you're coming on, join in. Ibrahim Ajibola Khadija, Balogun Kehinde Wells, Ibrahim Ajibola Khadija, Chioma Okoro. We have Edeme Blessing Omajubo. We have Oyewumi Omowumi, and we have Edeme Blessing. We have Balogun Kehinde Wells. We have Indidi Amaka Onwo. Good evening. Ella Charles Chinonso. And on Instagram as well, Margaret Ugochukwu, Lady T 1800. Sweet Something, welcome, guys. God bless you. As I was saying, medical issues too can cause and affect erectile function, affect erection. Medical stuff like diabetes, blood pressure medications, they affect. In fact, some blood pressure medications actually affect erection. They kill erection. They are designed to work that way, especially the most effective antihypertensive medications. They kill erection. Okay, so medical issues can kill erection. It's important to know this. And obesity can also kill erection. Being obese, not able to move your body as supposed to move, not feeling healthy. Being obese, having high BMI can affect, can destroy, can kill erection. Okay? Listen attentively. Okay? Hypertension can kill erection. Poor breath, ventilating, not ventilating well, poor sleeping can kill erection. Not sleeping well, poor sleep, stress can kill erection. Overworking can kill erection. Clear orgy, messy otimi. So as a guy, as a man, you have to pace yourself. You can't kill yourself. God help us, God help me. You have to pace yourself. You have to do things slowly one at a time, and don't allow stress to overcome you. There's good stress, there's bad stress. Bad stress is stress that is destroying your body. Good stress is stress that is challenging your body to do better, to function better. Exercise can be good stress, can be bad stress. It's how you use them. So you see, if you don't for example, exercise done properly, regular exercise can be good stress for you, but not exercise, not doing the things you're supposed to do can be bad stress, can be bad for you. Okay, Adesola or Nobimi, welcome. Chinyere Iguatu. Chinyere is asking a question about oligospamia. Just hold on. For your questions, hold on. For questions, hold on. Okay, please hold on. Questions, hold on. Let us finish this topic. Okay. All right. So there's a question waiting from Chinyere Iguatu about oligospamia. We'll talk about that. Okay. So just hold on. Now, as I was saying, weak erection can happen because of medical problems, okay? And it's very, very common for men not to want to discuss these things openly. Today, all the time, every time, whenever there's issue with a man's sperm count, most men want to hide and discuss this issue privately. It's natural. It's okay. It's not a sin. You're not the only one going through it. People go through things. So weak erection is not a death sentence. It's a problem. It can be overcome. But first things first is first of all, look into yourself. Poor habits, cigarette smoking, drinking heavily, getting drunk, having high BMI, not doing regular exercise, okay? Having blood pressure, clogged up arteries, they can affect erection because erection itself is a function of blood flow. Blood must flow through your penis, okay? And that blood is not stored there, is not allowed to return. So blood flow is what makes a man have erection. Erection is a function of a proper blood flow. And if you look at all those Viagra medications, what they do is that they open veins and allow blood to pool in your veins, okay? That is the way all those sildenafil, Viagra, that's the way they work. They allow blood to pool in the veins of your penis and make the penis engorged, okay? In fact, the veins in the penis are like sponge. They get engorged, the penis gets erect, and that blood is cut off not to return back to the body for that point in time. Okay, so that person has erection. After a while, it will now relax. Some people suffer from prolonged sustained erection. People that have that sickle cell, people on medications for chemotherapy, and so on and so forth. And some people with the diabetes itself, they can have what we call priapism, sustained prolonged erection that can destroy the penis. And in fact, in such cases, we have to drain the blood off the penis. Okay, forcefully and quickly, otherwise that blood is stuck in the penis. It can kill and destroy and cause ischemic necrosis on the penis. So we have to drain. So prolonged erection is bad. Not having erection is bad. The most, like life in all cases, there must be a balance. Prolonged erection is bad because the penis will pain that person. If you see people that have priapism, that have got sickle cell, that are suffering from priapism, they are in pain and they are crying, and you see them in A&E, in loot, carrying their penis like this, that is paining them, that they should help them. That is pain. Prolonged erection can cause priapism and can be very painful and can be debilitating. So prolonged erection is bad. Not having an erection at all is also bad. There must be a middle ground. Okay. In fact, if you have prolonged erection and you're pounding your wife, after a while, the vagina will get dry. The woman will say, "Stop there. It's enough," because it can be painful too for the woman too. It's like we are pounding the mortar. It's not good. So prolonged erection is bad. No erection is not good. Let's find the middle ground. Now, when people suffer from erection problems, the first thing they think of in Africa is herbs. Let me go and look for one agbo or some concussion that can help. There are many things now on Facebook, on YouTube, people selling so many things to help men to prolong erection. In fact, the market for anything that can enhance erection in any man will sell anywhere in the world. You come out with anything, make it anything, whether it's stone, powder, root, or for any plant, and say, "This thing, you buy this thing, no, guys, you're gonna have erection." Women will buy it for their men will buy secretly, and you'll be a trillionaire in one day. Erection problem is a problem, it's a big deal all over the world. Now, I have some simple tips that you can do as a guy that you can do for your guy to enhance erection. It might not work for everybody. It will definitely help some people. It might not work for everybody, but it will definitely help somebody that might need, or somebody that has this kind of problem today. There's a question here as well on Omotolani from Instagram. She's saying that, doctor, after doing HSG, you found out that the tube is blocked and later you go for flushing. That's okay. First of all, tubal flushing, which is called idotubation, does not work all the time. Tubal flushing is done to clear blockage in the tubes. Tubal flushing is done to clear blockage in the tubes from diseases, from infection in the past. But tubal flushing, which is idotubation, does not work in most cases. And in fact, it works only about 1 out of every 4 patients, okay? If it's not working for you, you've gone for tubal flushing idotubation and it's not working, the next thing will be to consider you doing what we call HSG. IVF, okay? But that's by the way, okay? So, Motolani, if your tubes are blocked after flushing, it's IVF. Now, one of the best ways to treat or to reduce problems with erection is, first of all, distress. Know one thing: you accumulating stress, letting stress build up in your system is not going to help you. In fact, because you don't have erection, it makes things worse, because you'll be thinking about it, worrying about it, becoming stressed more. It becomes a circle and it keeps going down. Let me tell you something. Stop it there. There's no reason why you should have weak erection. Okay. Now, sometimes you do sex for 20, 30 minutes, 10 minutes. Sometimes you have no erection, you're busy. Sometimes you have erection easily, but sometimes you're just too busy. You're so engrossed with your work, there's no time to have erection. It's not a big deal. In most cases, if you have no spinal cord problems, God forbid bad thing. In most cases, if there's no bone injury, in most cases, if there's no nervous system problem, most men do not have erection problem. Okay, most men don't have it. I've seen people, they'll say, hey, but I've done everything, yet I don't have erection. You are going through something. There's something occupying your mind. Let me tell you something. Negative force and positive force can never occupy the same vessel at the same time. Negative force and positive force cannot occupy the same vessel at the same time. The same thing to faith and fear cannot occupy your mind at the same time. As soon as you are thinking of positivity, negativity leaves your mind. As soon as you start thinking of negativity, there's no way positivity will leave your mind. If you're not having erection, there's a high chance, 80 out of 20, that you're stressed about something and there's something occupying your mind. Trust me, there's something occupying you. Imagine you having sex with your wife. Suddenly you're thinking about your business or your vessel on the ocean or your car or your cargo coming in. Suddenly you lose erection momentarily. Whenever you're having sex, you must put your mind in the bedroom. Once you take your mind out of the bedroom, whether you're a man or woman, erection goes. It's natural. You must keep your mind in the bedroom. Most couples don't know this fact. You're having sex, suddenly you as a woman, you're thinking of your business, you're thinking of something else. You will have dry vagina. Many people come to me every day, doctor, my vagina is always dry. I've done everything, yet it's always dry. They don't understand that actually in the bedroom, most women, they don't put their mind in the bedroom. The same thing too for the men too. You are having no erection because you are getting worried. You're thinking that you might get the woman pregnant. You're thinking that you might not be able to get the woman pregnant. You're thinking that you might have premature ejaculation. You're thinking that you might mess up. You're thinking that you might not do the sex properly. So that stress builds up within you, and you can't perform. It's happened to me before too. You assume that you're probably going to have a premature ejaculation. You're not going to perform for perform for 10 minutes or 20 minutes. You lose the erection. It goes away. But there are simple things you can do. Okay, first of all, number one, believe that you can. If you don't believe that you can perform in the bedroom or you can overcome erection problems, you will not overcome it. You have to first of all believe that you can overcome it. You must believe. You must know that this is a problem for me. I can overcome it. Most people don't get to that point. They keep on staying in denial that it's a problem. I can't overcome it. I'm going to look for herbs. First of all, before you start searching outside help, dig in within you and search for that help. It's most answers to our life problem, to our medical problems, to our physical problems, even spiritual problems, always lies within us first. First of all, look inwards and see what can you change. What can you change within you that can change your situation? That's number one. Number two, A lot of men, unfortunately, don't have time for their body. Regular exercise. You see, if you learn to do regular exercise, it helps your body, your heart to function well. It helps your lungs to open up well and for air to come in easily and better. It helps you to stand and withstand stress in the bedroom and perform longer and better. It also helps blood to flow to the end organs, to flow to those tiny areas, especially your penis as well, and makes your body function well. It helps the blood to fill the veins and veins to dilate. That is why usually after you've done your gym, you look fit, you are happy within yourself. Suddenly you start to become and you look attractive. It boosts your inward environment and suddenly erection becomes not a problem. Most people don't know that once you start the wheel in the change in a positive direction, it continues and it enhances itself. You start to have regular exercise time for yourself, meditate, spend time with your body. You start to feel fit. You know you're on the right track. You start to look and you feel sexy yourself. Man and woman is the same thing. And blood flows into your veins. Remember I said that erection as a guy, erection for men is a function of blood flow. The more you regularly have exercise, the more blood will flow to your penis. The more blood flows to your brain. The more your heart works better. See, sex is not an easy job. Sex is highly energy demanding for the human body. So you must keep fit to be able to perform well in the bedroom. Yes, you must keep properly fit to perform in the bedroom. Having sex is not just fun. People get exhausted. Some people even die on the bedroom. Haven't you heard that before? From exhaustion. You have to keep fit. It helps to boost your testosterone level. Do that alone. Suddenly things start to get changed for you. Your body is firmer. You breathe faster. You're better. And during sex, people that don't have regular exercise, they're not able to breathe well. To hold erection, to sustain erection, to avoid and prevent premature ejaculation, you must learn to control your breathing. You must learn to hold breath. You must learn to keep air within. If you don't know how to control your breathing the breathing, there was a time I did a video about 2 years ago about how to breathe during sex. If you don't know how to, you end up having premature ejaculation all the time and you get frustrated. There is a place for that. Regular exercise can never be taken for granted if you want to learn to perform well. It's also important that you consider your environment. Two of you should learn to spend time away from your usual environment. Do something nasty. Do something outside the books with yourselves. With two of yourselves. Your husband, you, the wife, you. Two of you go to places that are totally new to you, that people around you will not even know you, that you can shout and you can have sex and anybody hearing your ringing tone do not even care. You must learn to step out of your comfort zone and go to places, maybe go on vacation where people don't know you, so that by the time you two of you are shouting and you are ringing your tone out and you are enjoying the thing and you are making all your grunting and your noise, nobody is there to disturb you and you are able to perform to your full and to your maximum best. That is very good. That is very essential. Some people might need counselors. You need someone to talk to encourage you. I remember I was talking to a couple about 18 months ago in London here on the phone, and I went through information, some details with them, and suddenly their sexual life experiences changed for the better, and they're having sex together, they're enjoying each other. You might need a counselor. Unfortunately, I don't have much time to do the counseling part of it again as before. Yes, a counselor might be just what you need. There are many counselors around. All you need to do is to search around and get someone you can trust, that you can open up to. Let me tell you something. There's nothing, sex with a man and woman is not a sin. You see, humans are designed to have sex. It is just natural order. So if you are married, you are your wife, there's nothing wrong with two of you having sex. It's not a sin. It's not a sin. In fact, you having sexual urge momentarily once in a while is not a sin. Don't cast any demon out. It's not a demon. It is God, what God made within you. The problem comes if you start to misbehave and become uncivil around people around you and start to disturb people and start touching every woman or touching people without sensibility. That is where the problem comes in. Okay, but there's nothing wrong in you seeing a woman and acknowledging that the woman is beautiful. There's nothing wrong, and there's nothing wrong with you seeing a man and acknowledging the man is handsome. There's nothing wrong. It's when you go out of boundary and you take matters in your hand and you misbehave that you will enter into trouble. Okay, good. Good evening, Joy, Tionsha, Godwin. Thank you, Jessica Eze. Jessica Eze, please, any of our moderators, can you talk to Jessica Eze? There's a question here that does age affect erection? Yes and no. No, in the sense that I've seen people that are 75, and if you jam them as a young woman, they will finish you on the bed. Yes. And I've seen people too that are 40, they can't perform on the bed. But definitely age and time has a factor. The way you do your acrobatics and mathematics as a 75-year-old man is different from the way a 20-year-old boy will perform. And in fact, with age comes experience and tactics. If you deal with a fit 75-year-old man, the person will finish your I don't know what they call that thing, sir. Let me lose masturbation. You see, so people are different. Yes, age has an effect, but it can be managed. I'll tell you that on the honest fact. Okay. Good evening, Honey Mary. Good evening, Jessica Eze. Good evening, Claire. Thank you, Claire Oji. If you need to talk with me one-to-one about sexual problems, counseling, your man, your woman, I usually love to do the counseling part of it, and it has to be with two of you. I don't do counseling with a woman alone or man alone. Two of you has to be there. I've realized that from statistics, when I talk to the man and woman together, their lives changes faster and better, and it's long lasting, and the resultant change positively lasts longer and is visible and is palpable and is far rewarding. So if you want to discussion to counseling regarding your sexual life, yes, you're welcome to join. I'll put you on the waiting list and I'll get back to you as soon as possible. But the link for the consultation for sexual problems, our team members will put it up on the screen now, and then we'll talk about it. There's a question here. Now, let's open the floor for questions now, okay? With the questions we will answer, we'll probably touch on other things that people have in their mind. There's a question here about Gorontula. I think Gorontula is some sort of fruit or seed, like dates or something, in the northern part of Nigeria or in the northern or in the Arabian part of the world. I think what it does is that Gorontula makes the vaginal juice slimy. It makes it very, probably taste better. But I don't think, and so people also think that it's also an aphrodisiac. Now, I don't know the full details of the aphrodisiac properties, but definitely if it works for you, then use it. Okay, as far as it's not something like a drug or steroids, if it works for you, fine. In fact, I talk about Korean ginseng all the time here on this our Facebook group. I also always mention about Korean ginseng. Korean ginseng contains ginseng, and what ginseng does in the body of a man is that it helps the veins to open up. It helps the veins to dilate and blood to flow into the Pcos, and the thing gets good erection and it can perform better. So that is what ginseng does. In fact, some people even eat ginseng raw to open the blood supply to the brain, and they can think faster, they can read better. In fact, if you look at the Red Bull, that drink people drink, it contains ginseng, but also with high level of caffeine. So don't go and start consuming Red Bull to get ginseng, because it contains high level of caffeine too, which could be dangerous to people's heart if you're not fit. A question here, but if you're my Arinze, how much is HSG? I need to get the actual cost. We don't do HSG yet at the ATG laboratories. So what we do now at the ATG laboratories that we do hysteroscopy and ultrasound scan. So basically, we do hysterogram. So basically, hysterosonogram. We don't do the HSG, which is painful, but we do the hysteroscopy, and we can do scans simultaneously to check the patency of your tubes. Somebody said something improves fertility. Thank you, Chinyere Egwatu. God bless you. Vivian Dico Briggs, happy birthday to you yesterday. Thank you for joining up today. On Instagram, if I can see Christina is here. Christina, thank you so much for joining. Christina is one of our moderators. If you have any questions on Instagram, please pop your question on the screen now and let me answer your question on the screen. So if you're watching me on Instagram now, it's the time to ask questions. Let us dissect questions. But yeah, Chinyere Egwatu is asking that how do you deal with oligospamia? Now, if your sperm count is low, okay, now there's a difference between oligospamia and azoospermia. Azoospermia means that there is no sperm. Sylvia Alozie is asking that about how much is IVF. Please, can somebody help me to answer Sylvia Alozie about the cost of IVF at the ATG laboratory? Now, first of all, Azoospermia is that there's no sperm in the ejaculate. There's no spermatozoa in the ejaculate, in the semen. Okay, that is the first thing about that. So azoospermia is not what I'm discussing. I'm discussing about low quantity or low quality of sperm as a broad term, oligospermia. One thing you can do is to regular exercise, boost your testosterone level, avoid overheating, lose weight. Number 3, you can use Adizua or Proceed for 8 weeks and see if it helps. If it helps, that's fine. If it's not helping, then we can do or use High to get you pregnant. There's a question here by Lady T on Instagram. How can one conceive with low thyroid hormone? If you have low thyroid hormone, what we need to do is to boost your thyroid hormone with medication so that we treat your low thyroid hormone and then getting pregnant does not become a problem. How can I bring my prolactin level down? If your prolactin level is high, first of all, that means that you've done your prolactin level check. Fine, that's good. It's always good to have a baseline before you start treatment. Then you start treatment, bromocriptine, Dostonex, regularly as prescribed by your doctor, and use it for at least 4 to 6 weeks to bring your prolactin level down. And then at the end of the 4 or 6 weeks, you repeat your prolactin level to see if it's coming down. And if it's not coming down, then we need to increase your prolactin level. How can the person that has ovarian cyst, what can they do? What medication can they take? First of all, let me tell you the truth. Vivian Itua, there's no medication to shrink ovarian cyst. Take it from me. If anybody is peddling any drug to you to shrink ovarian cyst, there's no medication to shrink ovarian cyst. I've heard people talk about some syrups, some molasses that they shrink ovarian cyst. I don't understand how those mechanisms work, so I can't advocate for them. But from what I know as a medical doctor doing gynecology for about 18 years, there's no medication that shrink ovarian cyst. But however, most simple cysts contain nothing. They contain only water. So most simple cysts that are less than 4 centimeters in size will shrink and will regress and will disappear after you scan them again about 3-4 months down the line, as far as they're not causing pain. But if they are causing pain, it might be a good idea to go and get them removed. Ovarian cysts. There's a Momo Fat is asking a question that, does taking green tea enhance infertility or enhance fertility? No, it doesn't. Oluebube is asking a question here on Facebook, and she said that question is going. Oluebube, I can't see your question again. I saw Oluebube somewhere and it's gone off my screen. Can you help me, somebody? Does COVID vaccine affect fertility? No. COVID vaccine does not affect fertility. All right? COVID vaccine does not. Do you control your breath during sex? Okay, how do you control your breath during sex to avoid quick ejaculation? It's very simple. I talked about this a while ago. I'll talk about it before the end of today. So hold on. If you want to hear how you control your breath during sex to prevent premature ejaculation, just hold on here, okay? How effective is Adizua tablets? It's very effective. Go and get it done. How effective is how do you treat no sperm cell? If there's no sperm cell, what we do first of all is to do your FSH level to see, is that hormone FSH from your brain, is it being produced to tell the testicles to produce sperm? If it's not happening, they might give you some FSH injection to see if it would help. But if it's not going to help, but if you're producing FSH, okay, and your testosterone is normal, then we try to see whether we can aspirate sperm from your testes. If we try and we can't see any sperm from your testes, it might be a good idea. Or if we get low quality sperm, then it might be a good idea to consider sperm donor to get you pregnant. Okay, right? Is regular discharge normal? Yes. As far as your discharge is not smelly, it's not itchy, it's not offensive, it's normal. Every woman has a discharge. I'm here to see a woman that does not have a discharge. Discharge is normal. Discharge helps to cleanse and make the vagina very good and healthy. All right. Now, let us look for questions here on Instagram. There's so many questions here. Olebube, what's your question, please? I couldn't see it. Your question came up on my screen and it went away. Okay, it's not my fault. It's just the fault of software and algorithm on Facebook. So Olebube, hey, more woman is asking a question about IVF cost. IVF cost. Please follow the link on this our group. Somebody will tell you how to get a cost. You can call the lab tomorrow morning. What high are you high about oligospermia? What high you high? I don't understand. I don't know what you mean by what high you high about oligospermia. What high you high? I don't know what that means. Please text it properly. There's no rush here. What's the best treatment for PCOS? To lose weight. Try and lose about 4 to 5 kilograms of your body weight. You see PCOS, 80% of people, it will disappear. PCOS, first treatment, weight loss. First treatment, weight loss, okay? Elena Collections 2, welcome to ATG. Welcome to ATG Instagram. Right, I'm still, okay. What's her name again? One lady asked a question. God, so fast. I wish I can read very fast and I can talk very fast. Unfortunately, I can't do that too much. Thank you, Chidima Oji, for your posting. I can see your fingerprints there. Okay. Let's talk about the breathing technique. Okay. Chinyere said, you said treatment for Oligospamia is high. You high. Or maybe I didn't get it. I don't understand what you're writing. Chinyere Egwatu. I don't understand your text here. What is high, you high? Oh, IUI. Sorry. Intrauterine insemination. Intrauterine insemination. Basically, we take the sperm and you see the man's semen, we spin it in the laboratory, we go and aspirate the best sperm from that semen, and then we use it to get you pregnant. IUI. Thank you, Admiral Kelvin, for explaining to Chinyere. IUI. Thank you. God bless you. Thank you, Chinyere. It's IUI. Intrauterine insemination. I have miscarried last month, and this month my period is dark. No, you don't worry. You see, usually after a miscarriage, usually after fibroid removal, usually after your first period, after your normal delivery, your period could be slightly darker than expected. It's okay. It doesn't mean anything. It will clear up later. Doctor, please, I didn't get the answer for how effective is Adizwa. Adizwa is very effective. It's very effective. And a lot of people have been taking it on an ATG, as we told them, even free advice. What people would normally pay to doctors like me to get answers to, we tell people free here. You don't even pay for it. But because it's free, you don't believe it. So what people pay for from doctors like me to get answers, we give it to you free. And this is why it's good. Use it. It's not going to kill you. Trust me. All right. Doctor, does green tea make bleeding like 2 weeks? No. IUI is not for PCOS. Intrauterine insemination is for poor sperm quality. Intrauterine insemination is not treatment for PCOS. We're not talking joke here. Okay, I know what I'm saying. Intrauterine insemination, I didn't say it's for PCOS, so, and it's got nothing to do with PCOS. It's entirely different, and it's for oligospamia. Now, let's talk about the breathing technique that can help a man to reduce premature ejaculation during sex, especially if it's your first round. At some point, you are excited. It's normal. At some point, you are looking, if you're doing dog, you're looking at the shape of the big bonbon, like tire in your front, and it's exciting you. Or if you're doing missionary position, looking at those two dangling and bouncing in your front, it excites you. It's normal. Your body is designed to get freaked out that way. It's normal. It's God's design. There's nothing. You see, it's normal. Human beings are designed to have babies if they want and whenever they want to. Okay, so it's normal. So, but as a man, we usually get to that point quicker, much quicker than most ladies. Yes, it's natural. It's normal. What you need to do is, if you're too excited, you can slow down. You can withdraw, slow down, and chill. Or during sex, breathe in and out, obviously, like this. By breathing in and out, you tend to release the tension in a sequential way, and it reduces your tension to release. It works. That's why you see some people, some people, okay, let me not go that far. Let me just stick to my task here and get my task done. During sex, like you're standing like this, and you're doing doggy, and you're going, breathe in and out. Don't hold your breath. You can even make it sound like as if you're sucking in air because you're eating a peppery stew. You know those Yoruba stew that is always very peppery, and so always very peppery. Like this. Breathe like that. It helps a lot. Okay, that is why, as a man, before you go to bed every night, make it an habit to do breathing exercise. Okay, by doing regular breathing exercise, okay, it also helps and enhances your breathing technique during sex to reduce premature ejaculation. And how do you do breathing exercise every night? This is what you do. Before you go to bed, taking a deep breath like this and hold it there for about 4 seconds. After a while, you'll be able to hold it for up to 10 seconds, 20 seconds, okay? But no big deal. Do it for about 4 or 10 seconds. It's enough. So now I'll do it together with you, and it's very simple. Do it about 4 to 5 times before you go to bed, and do it every day. It's not just because you've done it one day is not okay. Do it every day. I've been doing it for the last 4 years. Do it every day. So now let's do it together as a guy, as a woman. Do it together with me. So I'll do it now. So look at me. And you breathe out. You don't have to do it standing up. You can do it while in your bed, just a few minutes before you sleep. In fact, it even makes you sleep faster. It makes you sleep better and make you relax more while in bed. I've been doing it and I loved it so much. In fact, whenever I'm going through difficult times, stressful times, you see, I'm a businessman. We run so many businesses on ATG. We run in laboratory, IVF center, ATG online, blah, 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 blah. It's hectic, and I do my day job as a doctor, and I have a family with a new baby. It's hectic, trust me. But you need to build your system. You need to build your body by the grace of God to withstand, because these things are essential to keep us here. As far as you are alive, you will always have stress. It's how you deal with them that matters. So you have to equip your body to ready to handle when these things come. So always do that exercise breathing every night. You can do it in bed. You can even do it on when you're in the bathroom, when you are doing your business. Number 2, just do that thing constantly. What I've done now, do it for at least 4 to 5 times before going to bed. Do it every day. If possible, do it even while at work. And during sex, do it even more better. It will make it easier to hold your ejaculation and prevent premature release. You don't have to take any agbo or any concussion for it. Tell the whole world. ATG has only a center in Lagos for now. When can you book hormonal injection for no sperm in your clinic? Becky Fabule, I don't understand what you mean. No, you're getting it all wrong. Please call our IVF center tomorrow morning. Speak to Dr. Chioma. She'll carry you along. Barbara Edos is asked, after Clomid treatment, how long are you to wait before going? After Clomid treatment, how long should you wait before going to test of pregnancy? Usually, if you're on Clomid, okay, we start you on Clomid from the beginning of your period. Usually from around day 2 or day 3. Take it around day 5. Okay, you now go for what we call this follicular tracking scan around day 9, 10, 11, or day 12. Once we see the dominant follicle, we tell you to go and start having sex. Usually, from 2 to 3 weeks from that sex, you should do a test of pregnancy. And if you got pregnant, you see positive test. So there's a question here about Ulebube fever. How do you know if you have PCOS? Usually you have irregular period, your periods are scanty, you have facial hair like me as a man like this, you have facial hair, you're obese, okay? That could be a sign that you have polycystic ovarian syndrome. But we must do your testosterone level, your LH hormone, FSH hormone, and ultrasound scan. All these things will come to give us all the things we need to see to know whether indeed you have polycystic ovarian syndrome. Some people have polycystic ovaries. They don't have polycystic ovarian syndrome. Polycystic ovarian syndrome, then there must be problem with your testosterone level. You must have oligospamia, and there must be facial hair in most cases. Then we say this person has polycystic ovarian syndrome. And also polycystic ovarian syndrome, because it's causing scanty period or irregular period, it makes it difficult for you to get pregnant. Okay, thank you guys for listening to me today. I really appreciate you. I know I couldn't answer most questions. Now, there's a question here by Temida. She's asking that, can a woman hold breath during sex? Well, most women do suffer from premature ejaculation. But if you find it amusing, you love to do that, it's okay. In fact, it's not only for ejaculation alone. Holding your breath and doing breathing techniques also has its own other immense health benefits. It's not only for sex. Sex is just part of life. Sex is not everything about life. Sex is just part of life. It's not everything about life. Just the same way too, making money is not whole life. It's just part of life. Okay. So if you want to do breathing exercises as a lady, it's okay, but it's not for premature ejaculation for the woman. Thank you guys. Hope to see you soon. Thank you for joining me today. I love you all. And thank you, Barbara Compson. I can see you there. Thank you for joining us today. Barbara Compson, God bless you. I can see you, wonderful lady. See you all soon. God bless you. It's going to be a long weekend. And don't forget that next weekend, not this one, the next weekend is our seminar day for male and female fertility. That day, I will talk not only on getting pregnant, but also how to enjoy sex. You know, sex is not only for pregnancy alone, it's also for enjoyment. So that is going to be a one-time wonderful day. If you're not yet registered for that seminar, this is the time for you to register. Follow the link to register down below. God bless you. See you soon.